In the last video, we done with introduction about sympathetic system and parasympathetic system. Now we talk about in detail about parasympathetic system first. The parasympathetic system, the fiber present in parasympathetic system known as cholinergic fiber. Because these fiber, they're producing acetylcholine, they're using acetylcholine as neurotransmitter. So what's from a pharmacology here, that the drugs we use for parasympathetic system, the drug who the work in the same fashion like parasympathetic system, or these drugs copying the parasympathetic system, that's why it's a cholinomimetic drugs. The cholinomimetic drug, another cholinergic receptor blocking drug against these drug name, the common name here, parasympathetic agonist and parasympathetic antagonist. Parasympathetic agonist and parasympathetic antagonist. Before we going for sympathetic, parasympathetic, the parasympathetic agonist and antagonist, first we learn about the receptor. What's the receptor present inside the sympathetic parasympathetic system? The two categories: receptor, muscarinic receptor, and nicotinic receptor. The some receptor present inside these both receptor work for acetylcholine. But why we divide these two receptors in two categories? These two receptor, nicotinic receptor, some receptor of parasympathetic system, they give more response to nicotine as compared to acetylcholine. The muscarinic receptor, muscarine is a chemical, is a come from one mushroom, is a one mushroom chemical, the muscarinic. That's why they give name muscarinic receptor. The mushroom chemical give more response as compared to acetylcholine. So two group of these receptor, that is a receptor. Later we see in next coming slide. You can see here the first the muscarinic receptor. What are the types of muscarinic receptor? Muscarinic receptor, we having types from M1 till M5, M5, M4. These two receptors present inside the CNS. We have no concern to discuss in the peripheral nervous system. The M1, M2, M3. These three receptors from M1 to M2 and M3, 1, 2, 3. These three receptors present inside the peripheral nervous system, parasympathetic system. These two receptors, M4 and M5, present inside the CNS system in the frontal lobe where we're using acetylcholine. The muscarinic receptor M1 and M3, they are common. Why? M1 and M2, and both the muscarinic receptor, they are linked with the G protein. The muscarinic receptor with the M1 and M3. M1 and M3 is related with the GQ protein. The GQ protein activate phospholipase enzyme as a second messenger system. This is the G protein activate second messenger system. The G protein, the types of G protein, GQ, GI, and GS. The M1 M3 receptor linked with GQ protein and activate the second messenger system. The second messenger system, it increase the level of calcium inside. So that this M1 M3 receptor present on the basically on the muscle, smooth muscle. For the smooth muscle, the smooth muscle function, if any gland releasing something, M1. So these receptors present over the gland, present over smooth muscle, because here we having the calcium influx. So for contraction function, for secretion function, we need calcium. So because the calcium, the GQ protein increase the level of calcium. So these M1 M3 receptor present over the muscles, present over smooth muscle and some glands for secretion and for contraction. The M2 receptor is inhibitory in nature. Later we see what their location there. The adenyl cyclase and the block the activity and they open the potassium channel. And open the potassium channel, what happened to cell? The cell undergo hyperpolarization. If the cell undergo hyperpolarization, it's mean inhibition. So M2 receptor is inhibitory in nature. M2 receptor is inhibitory in nature, and M1 M3 receptor, the putting calcium inside. After putting calcium inside, the cell can undergo contraction function. The cell can secrete something. Or it's mean these two receptors present over the hollow organs that containing smooth muscles. Containing smooth muscle and some glands there, also over the gland, M1 M2 receptors. Okay, now move on. The second category of the cholinergic system receptor, cholinoreceptor, nicotinic receptor. Nicotinic receptors, and there are two types of nicotinic receptor, NN and NM. NN mean NN, nerve to nerve, the present at the synapse. Present is for nerve number 1, it's a nerve number 2, and it's a synapse between these two nerves. The hair receptor present over the acetylcholine release from this nerve number 1 and act on the receptor on nerve number 2. That these receptors are nicotinic receptors. These are NN category. And NM, when the nerve is supplying to a skeletal muscle, this NM neuromuscular junction receptor, neuromuscular junction, nerve to muscle. And this actually is not a parasympathetic system. This NM receptor present in somatic system. Inside the parasympathetic system, we're using the NN receptor. We already know the receptor here from the brain and spinal cord. The one nerve is going out. The nerve is going out. This nerve, the first having synapse with the ganglia. So at the ganglia we have a receptor, NN receptor. And next is on this organ. This nerve is both ganglionic fiber going to the organ, the hollow organ, any organ here. It may be smooth muscle, it may be the gland, it may be exocrine gland. Here we have a receptor, the muscarinic receptor. So muscarinic receptor present over the effector organs, and the nicotinic receptor present between these two nerves. And this nerve is a preganglionic nerve, and this nerve is a postganglionic nerve. The receptor present between the ganglia, and this NN receptor. If we talk about we talk about sympathetic system. The sympathetic nerve is coming. So we having ganglia here again, NN receptor. And the postsynaptic, there's a postganglionic fiber here. The organ here is the organ, smooth muscle or gland, anything. Here we having a receptor. That receptor is, if this is a sympathetic system, that receptor may be alpha receptor, maybe beta receptor, maybe dopamine receptor, maybe any receptor, alpha or beta category receptor. This is what we don't need to talk here about sympathetic system. Have more concern with parasympathetic system. So in parasympathetic system, second type here, nicotinic receptor. And this nicotinic receptor not belongs to parasympathetic system. But why I mention here this nicotinic receptor here? Because this somatic system, acetylcholine we also use in somatic system, not just only in sympathetic and parasympathetic system. Acetylcholine we also use in somatic system. The nerve supply to muscle, that nerve is also acetylcholine. They're using neurotransmitter as a neurotransmitter using acetylcholine. That's why it's an NM receptor. What's another difference between from the NM and muscarinic receptor and nicotinic receptor? You can see here the muscarinic receptor, both receptors linked with the G protein. And what the main difference here? Okay, you can see here there is a link with ion channel, and these receptor ion channel very rapidly open, rapid close. Rapid open, rapid close, rapid open, rapid close. And if you stimulate, another thing, if you stimulate these receptors again and again, what happens? These receptors will rapidly undergo inactivation. If in the pharmacology, if any chemical, if any drugs acting on one receptor and receptor become inactive, it's term known as tachyphylaxis. What is tachyphylaxis? Is the inactivation of receptor in response to drug. The receptor give no response. So ion channel very rapidly undergo inactivation if the one ligand continuously attached with this receptor and continue to stimulate. The ion channel can rapidly open, rapidly close, a very rapid response. But the problem here, if you repeatedly stimulate this ion channel, no more response. These are the differences of nicotinic receptor and muscarinic receptors. Okay, now I move on. What's the location of these receptors? The muscarinic M1, muscarinic M2, muscarinic M3. The muscarinic receptor, what's the main location? I just focus on the main location, okay? The muscarinic M1 receptor, I just summarize here. M1 receptor present over parietal gland or parietal cell. present over parietal cells. This parietal cell releasing what? The parietal cell release SCL. So M1 receptor help to release SCL. If you stimulate muscarinic receptor here, then what happen? More SCL. If you block the receptor, no SCL like this. So muscarinic receptor M1 present over M1 present in the gastric mucosa, parietal cell there. What's the location of M2 receptor? M2 receptor is very special for heart. It present over heart, not all heart. It present over nodes of the heart. Present over nodes of heart. SA node and AV node. Present over to decrease the firing from the SA node, to decrease the conduction from AV node, decrease the frequency of the current production from SA node, and decrease the conduction velocity from the AV node. And this node having M2 receptor, all it done was the M2 receptor. M2 receptor is inhibitory in nature, linked with GI protein. It can hyperpolarize SA node and hyperpolarize AV node. So that's why parasympathetic system having muscarinic receptor, M2 receptor, by using this receptor, parasympathetic system can decrease your heart rate. Easily. M1 receptor present over stomach. Now move on M3 receptor. What's the location of M3 receptor? M3 receptor have main concern with GQ protein. M3 receptor have main concern GQ protein. And GQ protein doing what? GQ protein add calcium inside the cell. When you add calcium, there must be contraction. So these receptors present over smooth muscles. And help for contraction. The M3 receptor present over smooth muscle, and the smooth muscle contraction relaxation there is done by M3 receptor present over smooth muscle and also present over the glands. Present bronchoconstriction, and also sometimes the vasodilation is done by. So the M is a function of M3 receptor. It's a function of M3 receptor. The location distribution done. M2 already explained, present on heart. Which part of heart? AV node as well as SA node, and decrease the heart rate. The M3 receptor present over the location, the smooth muscle as well as gland, salivary gland, lacrimal gland, the function, the control smooth muscle contraction and the vessel, but on the vessel is causing the vasodilation. This M3 receptor, the M3 receptor is a very important concept here. How the parasympathetic system causing vasodilation. The parasympathetic system, the causing vasodilation, the receptor M3 receptor present over intima, on the endothelial cell, not all vessel wall, not on the media. On the vessel, so sympathetic system have ability to supply the media wall of the vessel, but the parasympathetic system just supply the acetylcholine, just acting on the intima, and producing nitric oxide. When the G3 protein acting here and GQ protein acting calcium here, the production, and also increase the nitric oxide production in parasympathetic system, the action on the arteries, and cause nitric oxide very strong vasodilator. So the parasympathetic system help for vasodilation, not for vasoconstriction, causing vasodilation. This parasympathetic system in case of GIT help for contraction and motility control peristalsis. This M3 receptor present on the bronchiole, it help in the bronchiole causing bronchoconstriction. This is distribution of M3 receptor. The other category receptor are done the location N1 here and N nerve to nerve receptor and nerve to muscle receptor. The neuromuscular junction is a somatic system, and nerve to nerve receptor. Nerve to nerve receptor present between nerve, and nerve to nerve receptor also present over the medulla. So acetylcholine release also acting on medulla to release norepinephrine. The botulism toxin. Okay, now we go on how the neurotransmitter, how the acetylcholine is produced, and what are the chemical can stop the production of acetylcholine, can influence the release of acetylcholine. As we done in physiology, the acetylcholine, how acetylcholine is produced. Acetylcholine, acetyl-CoA is come from mitochondria, and the choline here, this choline combine acetylcholine esterase enzyme here, acetylcholine transferase enzyme here. This acetylcholine transferase enzyme is convert this acetylcholine so it's a neurotransmitter choline. This acetylcholine is packed inside the vesicle. Then this acetylcholine is released the outside. Then after acting, when the function done, acetylcholine receptor. This receptor may be nicotinic receptor. This receptor may be muscarinic receptor. It depends upon it's a effector organ or it's a nerve. And NM receptor or NM receptor are muscarinic M1 and M1, M2, M3, anyone. Okay, next here, what's the role of botulism toxin? What is the clinical relevance with the acetylcholine? The spider venom. What's a spider? It's a black widow spider. It's a black widow spider. It's a black widow spider. What's doing with parasympathetic system? This black widow spider increase the activity of acetylcholine. Acetylcholine release is increased. So it means that this black widow spider increase the level of acetylcholine in our body. If you increase the level of acetylcholine in your body, what happens with the parasympathetic system? The parasympathetic system, all our parasympathetic system using what? Parasympathetic system using acetylcholine. Parasympathetic system M1 receptor, parasympathetic system M2 receptor, parasympathetic system M3 receptor. The function of the M1 receptor increase, all function will be increased. What's the location of M1 receptor? The M1 receptor, gastric secretion, the HCl, more production of HCl. What happened with the heart? The heart rate going down. What happened with the GIT? It lead to diarrhea because more motility. What happened with the M3 or salivation there? Too much salivation, too much lacrimation. Diarrhea start, salivation start, lacrimation start, because these are the function of parasympathetic system. And parasympathetic and what with the GI, with respect to the GIT, diarrhea, with respect to the salivary gland, salivation, lacrimation start. What happened with the heart rate? Heart rate decrease. What happened with the vessel and vasodilation? Vasodilation, or your blood pressure going down. This happen if you having the spider venom enter your body, black widow spider. This black widow spider activate your parasympathetic system. What's a botulism toxin? Is how the spider act? This spider increase the release of acetylcholine from this vesicle when it enter your body. What's a botulism toxin? This botulism toxin is Clostridium botulism is a bacterium. This botulism toxin increase, it's block the acetylcholine. The botulism toxin, basically act on neuromuscular junction. At the neuromuscular junction is a somatic system, but the neurotransmitter we use in neuromuscular junction is acetylcholine. So if the botulism toxin enter your body, what happened? No more acetylcholine release. If no more acetylcholine release, what happened with muscle? The muscle paralyzed. What type of this paralysis here? This paralysis is flaccid paralysis. Why flaccid paralysis? Because no acetylcholine, it means no depolarization of muscle. If no depolarization, the muscle become loose and flaccid. The flaccid paralysis of botulism. So what's the clinical use here? What is strabismus? Strabismus is the condition of the ocular muscle, is a disease condition of ocular muscle. Ocular muscle become very spastic. Another condition, blepharospasm, the upper lid of eye, the muscle can contract repeatedly. We can use botulism toxin to relax this muscle. For strabismus, we can use this botulism toxin. So botulism toxin also helpful for some time. What happened? We have muscle spasm. So we can use botulism toxin to reduce the spasticity in the muscle. But in normal person, if the normal person have botulism infection, the botulism infection, it can lead to paralysis. This is a bit clinical relevance of these two things, the botulism toxin as well as spider venom. What spider when enter inside your body, spider venom when enter inside your body, what happened with your body, the overstimulation of parasympathetic system active, the more function of M1, M2, M3, the all these function increases, and what happened, parasympathetic activity increases. This is about the botulism toxin, spider venom. This is summary about the what happened at the nerve terminal when nerve terminal is releasing acetylcholine, how releasing, how acting. Okay, the remaining thing, now in the next section I will discuss about the drug of the parasympathetic system in detail.